The patient with an endocrine condition. Overview of the endocrine system. Endocrine glands secrete substances directly into the blood or lymph system. They secrete highly specialized substances, hormones, that, with the nervous system, maintain body homeostasis. Influences of the endocrine system on oral health and patient care are discussed in this chapter. Glands of the endocrine system. The major endocrine glands are the pineal, hypothalamus, pituitary, thyroid, parathyroid, thymus, pancreas, adrenals, and gonads, ovaries, and testes. The anterior pituitary is called the master gland because it regulates the output of hormones by other glands. In turn, the pituitary itself is regulated by the hormones produced by the other endocrine glands. Hormones and their functions. Hormones affect a number of major functions and are transported by the blood or the lymph. Hormones may act directly on body cells or indirectly to control the hormones of other glands. Complex and unified actions of hormones produced by endocrine glands augment and regulate many vital functions such as growth and development, energy production, food metabolism, reproductive processes, and responses to the body's stress and temperature. Regulation of hormones. Regulation of hormone secretion is complex and the mechanisms are not fully understood. Normally, hormones are secreted when needed. The stimulus for hormone secretion is often a chemical signal in the blood. When the hormone is released, the signal disappears. As more hormone is required, the signal reappears. The system of negative feedback works to provide hormones in optimal amounts and only in response to a need. Both hyposecretion and hypersecretion of a hormone can cause physical and mental disturbances. Endocrine gland disorders. When diseases affect the glands, hormones may be underproduced or overproduced, causing physical and biochemical changes that may have profound effects on the body, including the oral cavity. Presence or absence of a particular hormone may affect oral structures and may cause the host response to infection, healing, or stress to vary. Many systemic diseases and disorders are risk indicators or risk factors for periodontal disease. Hormonal fluctuations associated with puberty, pregnancy, and menopause can affect the periodontium and directly modify the tissue's response to local factors. The pituitary gland. The pituitary gland is composed of two functionally distinct portions, the anterior pituitary and the posterior pituitary. Each portion of the pituitary secretes different hormones. Excess or inadequate secretion of any of these hormones can cause severe problems for bodily functions. The anterior pituitary is also called the master gland because of its great influence on body organs, other endocrine glands, and overall well-being. Pituitary tumors. Adenomas are the most common pituitary tumors. These benign tumors usually secrete too much of one hormone. They can develop at any age. The types of pituitary adenomas include functioning tumor. It causes the other endocrine glands to secrete excess hormones. Non-functioning tumor, it secretes excess hormones that are inactive due to cell development process and may not be detectable in blood tests. Other types of pituitary disorders include craniopharyngiomas, benign tumors that grow near the pituitary gland. They're most common in children, teenagers, and adults older than 50. Racky cleft cyst, benign cyst in the pituitary gland. Common symptoms of pituitary disorders are headaches, vision problems, mood swings and behavioral changes, weight changes, reproductive problems, and hypertension. Oral health risk assessment. During the oral health assessment, the dental hygienist recognizes that the patient with a pituitary gland disorder is at an increased risk for macrocephaly, macrognathia, disproportionate mandibular growth, mandibular prognathism, anterior open bite, large pulp chambers, delayed eruption of primary and secondary teeth, increased risk for periodontal disease due to growth factors and hormone imbalances. Patient management considerations. Orthodontic evaluation, increased risk of hypertension, increased risk of developing insulin-resistant or type 2 diabetes. General anesthesia may be contraindicated due to electrolyte imbalance. The thyroid gland. Thyroid hormone receptors are present in almost every tissue in the body. This hormone plays a big role in normal physiologic function in the body, including growth and development and energy metabolism. Levothyroxine, or Synthroid, is used to treat thyroid gland disorders. It is the third most common drug prescribed in the United States. Hypothyroidism. It is the most common thyroid disorder, and it occurs when the thyroid does not produce enough thyroid hormone. It is more common in women than in men. Hypothyroidism develops slowly and is more common in people over the age of 60. Untreated or inadequately controlled hypothyroidism may cause an increased susceptibility to infections. The most common cause of an autoimmune disorder is called Hashimoto disease. Oral health risk assessment. Because of the autoimmune response, patients with hypothyroidism are at an increased risk for periodontitis, oral candidiasis, easily bleeding gingiva, poor wound healing. Medical management treatment is levothyroxine, lifelong monitoring. Patient management considerations. Monitor vitals, blood pressure, and pulse. Avoid aspirin due to increased gingival bleeding and poor wound healing. Increased risk for myxedema coma due to long-standing low levels of thyroid hormone in the blood. Myxedema coma is a life-threatening emergency. Hyperthyroidism. When the thyroid gland produces too much thyroid hormone, it's also referred to as overactive thyroid. It is called hyperthyroidism. This can occur over a short or long period. The cause, excess iodine in the diet. Graves' disease. It's an autoimmune disorder that affects the thyroid. Viral infection, taking too much thyroid hormone medications. The characteristics and oral manifestations are listed here. Oral health assessment. Accelerated tooth development, potential for malocclusion. Analgesics can increase the amount of thyroid hormones, making it more difficult to control hyperthyroidism. Vasoconstrictors are used with caution in patients with uncontrolled hyperthyroidism, as these may increase symptoms of tachycardia. Patient management considerations. Check vitals, blood pressure, and pulse. Thyroid crisis or thyroid storm is a sudden worsening of hyperthyroidism symptoms, which can be caused by an infection or stress. Immediate hospitalization is necessary. Parathyroid glands. As the parathyroid glands develop, they become embedded in the thyroid gland. Secretion of the parathyroid hormone, or PTH, is in response to the serum ionized calcium. The hormone controls calcium, phosphorus, and vitamin D levels in the blood and bone. All parathyroid gland disorders are rare. The most common cause of hypoparathyroidism is when the glands are accidentally removed during a thyroidectomy. Hyperparathyroidism. It occurs when the parathyroid glands produce too much PTH. It can cause long-standing hypercalcemia, which may result in osteoporosis. Symptoms of hyperparathyroidism: bone pain, depression, fatigue, frequent broken bones, kidney stones, nausea, loss of appetite. The oral health risk assessment. Loss of alveolar bone evident in dental images, spontaneous mandibular fractures, widening pulp chambers, and demineralized teeth. Patient management. Home fluoride therapy and increased risk of osteoporosis. Hypoparathyroidism. Hypoparathyroidism occurs when the glands produce insufficient PTH, causes the blood calcium levels to decrease and phosphorus levels to increase. It's the most common cause is injury to the parathyroid glands during thyroid and neck surgery. Symptoms: abdominal pain, brittle nails, dry hair, muscle cramps, muscle spasms or tendinity, increased muscular and periphery nerve irritability. Oral care risk assessment. Delayed tooth eruption, congenitally missing teeth, shortened roots, delayed or cessation of developmental dentally, enemal hypoplasia, poorly calcified dentin, widened pulp chambers, mandibular tori, chronic candidiasis, paresthesia of the tongue and lips, twitching or spasms of the facial muscles. Medical management. Calcium supplements needed. Patient management considerations. Home fluoride, antifungal medications to treat chronic candidiasis. Adrenal glands. The adrenal glands consist of a pair of glands that sit on the top of each kidney. The glands are composed of an outer cortex and an inner medulla. The adrenal glands work with the hypothalamus and the pituitary gland to produce adrenal, non-adrenaline, dopamine, progesterone, and glucocorticoids. Treatment for adrenal gland disorders is corticosteroids. Hyperadrenalism or Cushing syndrome. Cushing syndrome is caused by too much cortisol production. Increased production of cortisol can be caused by a tumor in the anterior pituitary, a tumor in the adrenal gland, or exogenous administration of steroids. Symptoms: weight gain, broad, round face, buffalo hump, hypertension, impaired healing, hypokalemia, hyperglycemia, glycosuria, polydipsia, mimics diabetes mellitus, increased bone fractures, mood swings and depression. Oral health risk assessments. Increased melanic pigmentation may develop black, bluish areas affecting the buccal mucosa, palate, tongue, and lips. Delayed wound healing, loss of collagen, skin and oral tissues fragile, and oral candidiasis. Bronzing of the oral tissues. Medical management, surgery or radiation, patient management considerations, antifungal treatment, and antiviral medication. Hypoadrenalism or Addison disease or adrenal insufficiency. Hypoadrenalism is divided into three categories: primary acute adrenal crisis, failure of the gland to produce cortisol or aldosterone. Primary chronic adrenocortical insufficiency, Addison disease, is an autoimmune disease. Secondary adrenocortical insufficiency, rapid withdrawal of steroids or insufficient steroid supplements combined with acute stress, infection, trauma, or surgical procedures may precipitate an adrenal crisis. Symptoms of adrenal crisis are a life-threatening emergency. Symptoms of hypoadrenalism include progressive weakness and fatigue, gastrointestinal disturbances, anorexia, nausea, vomiting, and diarrhea, hyperkalemia, hypernatremia, hypotension, profuse sweating, weight loss, hypoglycemia. Oral health risk assessment. Hyperpigmentation of the skin and mucosal surfaces. Long-term immune suppression may lead to Kaposi sarcoma, lymphoma, or lip cancer. Oral candidiasis. Medical management treatment is long-term steroid use, which is important to a patient management due to increased risk infection, increased bleeding, and poor healing. Patient management considerations. Monitor the blood pressure and pulse. Provide antifungal medications to treat candidiasis. Provide pain control to avoid stress and invoking an adrenal crisis. Consider anti-anxiety medications prior to dental treatment. Delay non-emergency dental treatment until condition is stable or well controlled by medication. The pancreas. It produces insulin to regulate blood glucose by the way of islets of Langerhans. Dysfunction of these cells can lead to insulin resistance and diabetes. Diabetes is a disease of metabolism with inadequate production or inferior processing of the hormone insulin. There's a strong evidence of prevalence of thyroid disease is higher in individuals who also have diabetes. Diabetes, the most common disorder of the pancreas. Puberty, stages of adolescence. The period of life considered adolescence is represented by the years between 11 and 21. The adolescent years, which include puberty, are marked by hormonal fluctuations as well as many physical and psychosocial changes. From a psychosocial aspect, the period can be divided into three overlapping phases: early adolescence, 11 to 13, middle adolescence, 14 to 17, and late adolescence, 18 to 21. Puberty changes. Puberty is a dynamic period of developmentally marked by rapid changes in the body's size, shape, and composition. Some individuals go through change early and faster than others. Physiologic changes occur due to hormone production and secretion by the endocrine glands, especially the gonads. In males, the testes produce testosterone hormones, and in the females, the ovaries produce estrogen, progesterone, and inhibin hormones. Hormonal influences. Pituitary hormones control the hormones produced by the ovaries and the testes. The several hormones produced by the ovaries are known collectively as estrogen, and those produced by testes are called androgens. Responsible for the development of sex organs, the accessory sex organs, and the secondary sex characteristics. As the levels of these hormones fluctuate during adolescence, they have strong physical, mental, and emotional influences throughout the body. The oral health risk assessment. Gingival inflammation due to the release of increased sex hormone. Diet analysis recommended to explore dietary-related dental disease patterns. Hyperplastic gingiva related to orthodontic appliances. Acute intraoral infections involving the periodontium require immediate treatment. Periodontal infections may be localized or generalized. Patient management considerations. Additional information about oral health risk and patient management considerations for the adolescent patients are found later on. Women's health, menstrual cycle. The menstrual cycle is the period from the beginning of one menstrual flow to the beginning of the next menstrual flow. Each cycle takes approximately 28 days. Menstruation or menses occurs in a cyclical manner, lasting 4 to 6 days from puberty to menopause. The rise and fall of hormone levels during the month control the menstrual cycle. Characteristics. Estrogen level rise during the first half of the cycle to prepare the endometrium for pregnancy. If conception does not happen, estrogen levels decrease and menstruation begins. Variation in the cycle are common. Factors affecting the cycle: changes in climate, changes in work schedule, emotional trauma, acute and chronic illness, weight loss, or excessive exercise. Premenstrual syndrome may occur 7 to 10 days before menstruation. Symptoms may include fatigue, headache, bloating, mastalgia, skin breakouts, cramps, food cravings, depression, anxiety, irritability, hostility, tearfulness, mood changes, reduced ability to concentrate. Oral health risk assessment. Exaggerated response to local irritants or unusual gingival bleeding may be noted. Patients may experience no specific gingival changes. Patient management consideration. Menstruation is normal and shows the body is healthy and functioning normally. Question women on the regularity of their menstrual cycle. Irregularity may reflect general health problems. Prevention through dental biofilm control, oral self-care measures, and removal of calculus at regular maintenance appointments can reduce oral effects of the hormone imbalance during menstruation. Hormonal contraceptives. A variety of effective forms of hormonal contraceptives containing estrogen and progesterone is available by prescription. Delivery methods include oral contraceptives, birth control pills. Intramuscular injection contains hormones to prevent pregnancy. One shot lasts for 12 weeks. Patch. A transdermal patch applied to the skin releases hormones to prevent pregnancy. Ring. A small flexible ring that releases hormones to prevent pregnancy inserted into the vagina once a month. Sponge. A round piece of plastic foam inserted into the vagina to block sperm from entering the uterus. It also contains a spermicide. Estrogen and progestin. A combination of synthetic hormone, estrogen, and progestin is nearly 100% effective in preventing pregnancy when taken appropriately. Oral contraceptives inhibit the release of gonadotropin-releasing hormones, without which the ovum cannot be released from the ovary. Oral health risk assessment. An exaggerated response to dental biofilm and other local irritants has been noted in patients who use any type of contraceptive. The gingival response is similar to that as described in pregnancy. Record the use of oral contraceptives each time the medical history is updated. Menopause. Menopause is the complete and permanent cessation of menstrual flow. Menopause generally occurs between the ages of 47 and 55, signals the end of fertility due to decreased production of estrogen and progesterone by the ovaries. Menopause is usually confirmed when a woman has no menstrual period for 12 consecutive months and there is no other cause for this change. Characteristics. Before menopause, menstruation changes in frequency, duration, and the amount of flow over a period of about 12 to 24 months. Menopause is accompanied by a number of characteristic physiologic hormonal-based changes. Many women experience only minor symptoms. A small percent have increased symptoms during menopause. General symptoms. As ovarian function declines with diminishing estrogen, physiological changes in the body function include vasomotor reactions. Hot flashes, defined as periodic surges of heat involving the whole body, may be accompanied by the drenching sweats. Hot flash may begin with a headache, proceed to a flushing of the face with heart palpitations, dizziness, followed by chills. The episodes may last a few minutes or more than 30 minutes. Night sweats and sleeping problems may lead to feeling tired, stressed, and tense. Mucosal changes are associated with fluctuating and decreased estrogen levels. Dryness, irritation, and thinning of tissue may occur. Frequent vaginal infections may occur. Emotional disturbances. Alterations in estrogen level may result in mood swings, depression, irritability, and difficulty with concentration or memory. Decreased libido and changes in sexual response. Some women experience anxiety, tension, and irritability and feel useless. Weight gain or increase of body fat around the waist. Postmenopausal effects. Reproductive organs atrophy. Osteopenia, osteoporosis have been associated with menopause. Skin and mucous membrane decrease in thickness and keratinization, becoming fragile and easily injured. Predisposition to condition including atherosclerosis, diabetes, and hypothyroidism. Burning mouth syndrome. Burning sensation in the mouth with the absence of an identifiable oral lesion. Described as burning, tingling, hot, scalding numbness. Causes unknown. Very common in menopausal women. Treatment include benzodiazepines and antidepressants or analgesics. Oral health risk assessment. Oral changes can be related to menopause, but they are not a common feature. Gingival changes associated with menopause usually represent an exaggerated response to dental biofilm. Hormonal changes influence oral tissue response. Menopausal gingivostomatitis may develop. It may also occur after removal of or radiation therapy to the ovaries. Changes to the mucous membranes and tongue. Tissue may appear Tissue may appear shiny and may vary in color from abnormal paleness to redness. Dryness with burning sensation may be present. Burning mouth syndrome may occur. Altered salivary composition in some menopausal women. Epithelium may become thin and atrophic with decreased keratinization. Tolerance for removable prosthesis may lessen, especially with xerostomia. Taste perception may be altered, described as salty, peppery, or sour. Inadequate diet and eating habits may contribute to adverse changes in the mucosal tissue. The appearance and symptoms frequently resemble those associated with vitamin deficiencies, particularly B vitamins. Alveolar bone loss. As a result of systemic osteoporosis, ridge resorption and loss of teeth can occur. Osteoporotic jaws may be unsuitable for conventional prosthetic devices or dental implants. Patient management considerations. During patient education, the relationship of oral conditions to endocrine disorders or hormonal fluctuations are considered. Emphasize the need for oral self-care measures due to hormonal fluctuations or imbalances. Consider oral effects of medications used to treat endocrine disorders and conditions. Control of local factors through preventive dental hygiene appointments with supplemental daily personal care aids, and create an environment that decreases the stress for the patient. Patient approach. Review and update the med history. Rapport begins with the clinician's courtesy, personal attention, and friendly, unhurried manner. Give particular attention to details such as seating the patient promptly, handling materials and instruments efficiently, and with a calm reassurance. Instructions of patients. Saliva substitutes may be needed to provide relief from xerostomia and in the prevention of dental caries. Measures for the prevention of periodontal infections can be carefully explained. Emphasize reasons for frequent calculus removal as supplement to meticulous daily self-care. Explain the relationship between good general health and oral health. Diet. Dietary assessment may help the patient identify the correct and adequately balanced food selections. Recommend whole grains, vegetables, and fruits. Choose foods low in fat and cholesterol. Recommend calcium to keep bones strong. Limit alcohol intake. Caries prevention through selection of nutritious and non-carcinogenic foods, especially important for the patient who snacks frequently. And fluoride therapy. Fluoride recommendations are based on assessment of the patient's dental caries risk status. Documentation. Patient's age and gender. Description of the patient's health status related to any endocrine disorder or hormone fluctuations. Symptoms and oral manifestations related to hormonal fluctuations.